Hi guys, today I'm talking about the parathyroids. Hyperparathyroidism is the most common clinical disorder of the parathyroid glands, and there is ischemia to the parathyroid glands may occur during thyroid surgery and result in hyperparathyroidism. We'll talk about the hyperparathyroidism. Hyperparathyroidism. Three types occur: primary, secondary, and tertiary. Primary hyperparathyroidism. This may result from a parathyroid adenoma. 85% is parathyroid adenoma and diffuse parathyroid hyperplasia. It causes 15% and rarely from carcinoma of the parathyroid. Hyperparathyroidism is a commonest component of MEN1 syndrome. MEN means multiple endocrine neoplasia. What are the symptoms and signs of hyperparathyroidism? These are classically stones, bones, abdominal groans, and moans. What are stones? Stones related to renal calculi occur in 5% of patients with hyperparathyroidism. All patients with renal calculi should have their serum calcium and phosphate checked. Then we'll move to the bones. Osteitis fibrosa cystica. Bone pain and fractures may occur. Next one is the abdominal groans. What are those? Dyspepsia, constipation, peptic ulceration may occur. Pancreatitis is a complication of hyperparathyroidism. Moans. Psychiatric manifestations may occur like confusion and depression. Psychosis. However, many patients have non-specific symptoms such as weakness, fatigue, lethargy, arthralgia, anorexia. Some patients are asymptomatic. Hypercalcemia being detected on routine screening performed for other reasons. What are the investigations we can do to hyperparathyroidism? We can do calcium, serum calcium. It should be increased. No tourniquet and correct for albumin concentration. Then phosphate usually reduced. Parathyroid hormone increased. Fourth one is the increased urinary excretion of calcium. Calcium restricted diet should take. Radiographs, skull may show characteristic ground glass appearance. Abnormal cellular turcica if MEN, multiple endocrine neoplasia associated with pituitary tumor. Hands, subperiosteal resorption of bone, best seen on radial aspect of middle phalanges and tufts of terminal phalanges. Abdomen, nephrocalcinosis. Differential diagnosis of hyperparathyroidism are need to exclude other causes of hypercalcemia like malignancy, myeloma, sarcoidosis, milk alkali syndrome. Parathyroid hormone is normal or low in these conditions. What are the treatments we can do to hyperparathyroidism? Surgery is the treatment of choice. Some surgeons consider preoperative localization of the glands, concordant ultrasound, and MIBI scans, MIBI scans, allowing a focused neck exploration to identify and remove only abnormal parathyroid tissue. If localization studies are not performed or are negative, all 4 glands should be identified at operation. Occasionally, there are 3, 5, or even 6 glands. A parathyroid adenoma is removed. If there is hyperplasia of all glands, 3.5 gland parathyroidectomy is performed. The residual gland should be marked with a surgical clip. When abnormal parathyroid tissue cannot be found in the neck or in the superior mediastinum, explore through the neck. The need for mediastinal exploration through a sternotomy should be considered. This should only be done after the missing gland has been identified by venous sampling, isotope studies, or CT MRI scanning. The missing gland may not be in the chest. It may be intrathyroidal. Parathyroidectomy is an operation for the experienced surgeon doing this type of surgery on a regular basis. Even so, an additional parathyroid gland may be overlooked and further surgery required. Hypoparathyroidism may occur post-operatively. Thank you. Subscribe to my channel.